Hello friends, welcome to Creative Medicine. In this lecture, we will learn about a patient is presented with depression for past 3 years and does not go out of his house much, and he is cut off from the society but with normal sleep and normal weight. What is the most probable diagnosis? Here, one important thing is he is cut off from society. Cut off from society indicates that there is severe symptomatology. Because it is severe symptomatology, here cut off from society will indicate that there is severe symptomatology, though the sleep and normal weight is seen. So in this case, the better option would be depression than dysthymia because of the severity in symptomatology. In dysthymia, everything is minimally affected, not severe affection. It is minimally affected in dysthymia. Thank you and thank you for watching.